group. Since it's Mother Days, and I'm sure a lot of mothers will be happy about these topics, I'm going to welcome Dr. Monika Singh. She's a specialist obstetrics and gynecology. Please welcome her.
Thank you, Sarah. Thank you.
Hi, Dr. Monika. How are you today?
I'm good, Sarah. Pardon, this is working? Hi, Sarah, I'm good.
How is everything?
Everything is okay, and I'm really pleased to be amongst you all because somehow Women's Day and the Mother's Day come in the month of March, and it is a very special month for all of us. So I welcome you all here. It will be a very short and interactive session where we will just basically we can gossip, and if you have any concerns and queries, we will discuss that.
So before we start, Doctor, can you please give our audience a bit about Dr. Monika Singh?
I'm Dr. Monika Singh Chauhan. I have done my master's from India, and then following that I did my senior residency in New Delhi. After that I eventually left obstetrics, and I'm a full-time gynecologist. My areas of specialty are benign gynecology, minimal invasive gynecology, pelvic reconstructive and cosmetic gynecology. So I'm basically a full-time gynecologist.
Pleasure to meet you, Doctor. So since today we're celebrating the Mother Day, I want to know what is the frequent questions usually you get in your clinic from the mothers, or we can say the newly mothers.
Sarah, being a woman and dealing with the woman, it's absolutely a privilege. I feel that it is a blessing where somehow I feel I instantly connect to them because it is so easy to relate to another woman. The most common conditions that a woman come across and we see in our clinical practice is heavy bleeding. We also see like the problems of fibroid, polycystic ovarian disease, endometriosis. So there are a lot of health conditions that a woman come with, but most importantly are the menstrual disorders. They have their concerns prior to pregnancy. Are they fit enough to get a pregnancy? Once they become pregnant, is their pregnancy a normal pregnancy or a high-risk pregnancy? These are small things they come up with. But if there is any specific question, then yes, I can answer in detail.
Sure, Doctor. My first question will be about the mother who's going to raise adolescent stage of the baby. So how is she supposed to deal with this?
Adolescent, dealing with an adolescent girl, it is very fascinating field. A mother who is raising a teenager, she should be very well aware that there will be lot of changes that will be happening to her in her teen life. First, she will get her menarche, that means she will start getting her periods. There will be problems of acne. There will be problems of obesity, like gaining more of a weight, or there will also be problems of eating disorders, like eating more or eating less. Possibly it is all because of the pressure from the social media, I would say. Mostly they come up with the complaints of irregular periods. Okay. A mother who is dealing with a teenage girl, she should be very well aware that there is a lot of things happening in her life. Not only physically, but mentally, emotionally, and there are a lot of things that we have to look into whenever we are dealing with an adolescent girl. Like a mother should be very cautious that the girl is eating well. I think if a girl eats well, does a regular physical activity, or plays any game or any sport that she's interested in, overall it improves her physical, mental and an emotional well-being. So I think the most important thing a mother should take care of when a child is growing, when a girl is growing, is a good diet and encourage her for sports. That's the most important thing.
That's awesome, doctor. Another question, mentally and physically, how should a woman be prepared if she's trying to conceive or she's thinking about to be pregnant? What's your advice on that?
If a woman wants to have a pregnancy and she's planning it, it is always advisable to see a doctor prior to having a pregnancy. It helps so that she is in a very good health and there is no contraindication or there is no other high risk factors that is added up when she gets pregnant. Like when a woman comes to us and asks us, doctor, can you find out if I'm good enough to carry a child? This is something which is a very, very important period, because if a woman is fit enough to have a pregnancy, usually she will have a very smooth and a normal pregnancy. But if a woman doesn't check before she gets pregnant, then there are a lot of issues that we have to deal when she gets pregnant. So dealing with the situation before she is pregnant is always better, and we must always encourage women to see a doctor before she gets a pregnancy.
That's awesome, doctor. As a mother, doctor, what is sort of the care she should provide in her child?
I believe that as a mother, the responsibility is immense. Really, a short interaction, the mother carries a huge responsibility. She doesn't only make her family, but she makes a community, a country, and I believe ultimately the whole world responsibility lies on a mother's shoulder, because it is the young generation which is going to carry forward the times to come. So I have always emphasized everywhere that it's very important what you do, the child does. So you got to be very motivated when it comes to your own health. When you are healthy, the child is automatically going to follow whatever lifestyle you are following. It's very important as a mother we take the responsibility to take care of ourselves, and eventually that is passed on to our child, and then the child takes care of himself or herself. So it's a big responsibility on a mother's shoulder.
I'm sure about that. Another question, doctor. I know a lot of women at certain age, they do develop certain symptoms, which is called menopause. I'm sure some of them, or maybe many, they are not aware that this is the transition. The transition. So can you please tell us about how to deal with it and how she should take care of herself during that time?
Today, as we are discussing about optimizing a woman's health in all stages of life, I think once she has completed her family, it is so important that she takes care of herself. There is a transition before menopause, is called perimenopause. A woman can have heavy bleeding, can have irregular cycles, she can have hot flashes, she will say that I'm unable to sleep, she can feel depressed. There are a lot of physical and mental components to perimenopausal health. It is very important to address that, because usually a woman, it is not always the symptoms that she comes up with. It could be very vague, that doctor, I'm unable to sleep, I cry frequently. In these situations, when you seek a doctor's help, there is always a solution, because we can offer something which will make her feel better, emotionally well, she can sleep well. If she has problem with her periods, we can deal with that. Most important is to take care of the bone health. The bone health is very important actually, Sarah, in these situations. So we can take care of the bone health, and overall most important other than the bone health is a breast health. So we have to take care not only about the gynec part, we have to look at a holistic approach to the health. It is very important when a woman is healthy in her 40s, her 50s and 60s are going to be amazing and fantastic. It's very important to make her realize that it's not only the child or the husband she needs to take care of, she is her own responsibility and she has to take a lot of care, because if she is healthy, the whole family is.
I can totally relate on that part, and that will lead us to the last question, at least my question, till we see the audience. How does the woman health evolve and adapt when she is in the postmenopausal stage?
Just to explain to the audience, what is postmenopause is when the periods have stopped and she's not getting her periods for more than a year. It is called as menopause. What happens in menopause, as I told you before, it is not only just a very small part is a physical aspect. It is very important that we deal with the emotional, sexual, mental health. All these form a very composite care that we can provide to a woman who is postmenopausal. So when a postmenopausal woman come to us, and what a woman should always take care is, if any time after the periods have stopped and she again starts getting her periods, it's definitely a warning sign. There is definitely something happening inside. It's a misconception, oh, my periods have started again after 50s or after she has attained menopause. If the periods have stopped and they started coming, there has to be some pathology inside the uterus. The other thing that we need to take care is a bone health. I already mentioned. The fractures happen easily. Most of the women will complain of vaginal symptoms. And they can be dealt with easily with just simple care, and importantly is the breast health. So these are small components. Other than that, the most important parameter to see a woman's health is that her weight is fine, it's normal, her blood pressure is okay, she's not diabetic, her bone health is good, there is no osteoporosis, that means she doesn't have weak bones. And if everything is fine and she's in a good mental health, I'm sure she's going to do very good in her 50s and 60s.
Thank you so much, doctor. But these are my questions. Let's see the audience if they have any others. I want to know from you all, sorry.
You can remove it actually.
No worries.
If any one of you have any questions.
Yes, please. Sure.
Thank you so much, Monika. I would like to know about the PCOD. Like, you have irregular periods and how to get rid of PCOD. Because that is more important nowadays. Generations, they don't eat regular food and all that. And I think because of PCOD, you gain a lot of weight. So how to get cure of that? Thank you.
What's your name?
Pratima.
Pratima.
Yeah, Pratima.
Thank you, Pratima, for this question. It's a very relevant and a very common question that we come across. Polycystic ovarian syndrome or a disease is a very common entity. There is no doubt about it. Unfortunately, how it comes, we don't know. It is said that it is genetic in origin. Like a girl gets it since the time she is born with. However, let me tell you, Pratima, the disease gets exaggerated or it worsens if a girl or a woman is not actively involved in sports activities. It's extremely important to be physically active. That's the key here, because we have limited medication for that, right? And it's basically you're born with. We cannot eradicate it. We can just modify it to become better, right? So it's very important to encourage young girls to be physically active, eat well, sleep on time. These small things, though they sound so simple, but they are so important, Pratima. Most important, why the polycystic woman gains weight is because of insulin resistance. So, and gaining weight also has a reason to it because of the kind of diet we are consuming. So it overall, when we see the whole picture, it boils down to our nutrition, how well we take care of that. Though unfortunately some are born with it, so the best thing that we can do is to modify it. You understand, Pratima? So the most important thing, because it's so confusing, it's a lifestyle disease actually. So encouraging a girl to be physically active is the key.
Thank you, Doctor. Is there anyone who wants to ask Dr. Monika anything before we proceed further? أي سؤال حتى لو بالعربي. I can't translate it.
Yeah, I'm sorry that I cannot speak in Arabic, but Sarah will
I'm saying
help
I
me.
can't translate it. لو حد عنده أي سؤال وممكن أترجمه للدكتور. Okay, it seems that nobody's willing to ask. Doctor, is there any other question, ladies? Thank you so much. So I would love, thank you first of all, Dr. Monika. And I would love please to ask Bioderma representative to come over.
Thank you so much, Sarah, and thank you, Mr. Arun and the BDSE team for this small little get-together. I would say it was so interesting, fascinating, out of the usual schedule. Thank you so much for giving me this opportunity. Sure, Pratima.
I would like to know, like, a certain age when we have a period, initial days we used to have for 7 days. After that it goes for 5 days. But when the women get age, why the cycle is for 2 days? Because after getting from so normal and we are getting so tense, like why we have this kind of I don't know how to say it.
Irregular periods.
Irregular. Sometimes
I understand.
it's heavy flow and sometimes it's like
Nothing.
nothing. So I would like to know on that aspect, like how can we take care of that? Thank you.
Sure, Pratima. I'll just answer you this in brief so that you understand. Some women can have heavy periods in some part of the cycle, and sometimes it's very light. Usually, as you said before, polycystic ovarian syndrome can result in light bleeding and sometimes in heavy bleeding. We have noticed some or the other form of hormonal imbalance happening. That is the time when you get heavy periods or light periods. If you will see, you will seriously, if you take a very close notice of your regular lifestyle, you will notice the months you have taken care of yourself and months if you have taken 3 months, 4 months. You would notice, I have seen a lot of young girls saying that they started getting their periods on time, the amount of flow is good. I have seen it all boiling down. Trust me, it's not only the medicine, it is how you take care of yourself. You have to take care of your mental health, physical health, be emotionally strong. Emotional health is equally important as your physical health. Having a heavy or a light period is fine if your hormones are okay and there is no other pathology. If there is nothing, you need not worry. That's very, very important for you to consider. Above all, my one message to you all beautiful women out here, please be physically active, be involved in sports, eat well, because if you are strong, everyone is strong. Trust me, it is not a small thing. If we are strong, our community, country, and ultimately the whole world, we need to shoulder this responsibility. Be strong, just take good care of yourself. Thank you.
Thanks everyone. And also I would love to add, whoever is shy to ask any question, Dr. Monika works here and she'll be happy to have you as her patient.
Thank you, Sarah.
Also now, Doctor, we will have our Bioderma representative. She wants to give you a number.
Thank you. Thank you so much. Thank you.
Thanks everyone. And Dr. Monika, it was a pleasure talking to you today.
Same here, Sarah. It was a very, very interesting.
Have a lovely day, everybody.
Thank you, pretty girl. Thank you. I'll give it to you.
Wow, that seems interesting, huh? Congrats. We need two people more. Anyone on board? You want to come? Yes, please. Your good name. Fatima, come on board. Spin the wheel. Yes, please. Oh, second row. Last person, please. Anybody on board want to spin the wheel? Anyone want to come and spin the wheel? Anyone is interested to spin the wheel? Otherwise, I'll do it myself. Yes, please, come in. I'm waiting. Your good name, please? Nice to have you on board, guys. Can you spin the wheel, please? Oh, something coming on. All right. Congrats, Franca. Thank you so much. Thanks, everybody.
Okay.
answer, and since I'm concerned about beauty, I would love to have an interview with Dr. Sayed. He's a dentist here in Virgin. Dr. Sayed, can you please join us? Dr. Sayed, if you can please join us.
Good afternoon.
First of all, I'm happy to meet you here.
Thank you.
Dr. Sayed, I would love to discuss with you some information today about oral hygiene, and specifically something that most of us are concerned about, the bleeding gum. So
Yeah.
can you tell us a bit of information about that?
Okay. The most commonest problem, what you can see in most of the patients in and around the world, is gingivitis, and commonly patients address it as bleeding gums. Okay. So the most commonest thing for bleeding gums would be improper oral hygiene. Okay. If your oral hygiene is good, then there wouldn't be any bleeding.
Okay.
And according to the surveys, more than 70% of the women have gingivitis during their pregnancies. So it becomes imperative for all the women around to get their teeth checked during the pregnancy time. And it becomes even more aggressive during the first trimester and the last trimester. So, and most of the patients who are pregnant usually complain of toothache or swollen gums during this time. So it's better to get a thorough checkup done from the dentist prior, and have a follow-up from the dentist.
Okay, doctor, can you tell us how can we take care of our oral hygiene?
Yeah, the most common thing what you can do is do brushing twice a day. Now, when I talk about brushing, everyone brushes, and most of the patients who come to me, they say that yeah, we have brushed and we do brush. But the issue is not about brushing, the issue is the timing of brushing and the frequency of brushing.
Yes.
Okay, as told by everyone, it is twice daily. But what I would recommend everyone is to brush morning after breakfast. Usually what happens is we tend to brush before breakfast.
Yes, this is
This
true.
is what everyone follows. Okay, so the normal idea is like we have bacteria in our mouth, okay, and the bacteria grows normally, but the bacteria needs food to grow. Okay, like we need food to grow, the bacteria needs food to grow. So when you are eating something, you are giving food to the bacteria indirectly. Okay, so when you eat and then you brush well, you don't have anything over there left. So the bacteria cannot strive over there. Hence your oral cavity will be free of bacteria and free of bleeding gums.
Okay, this is a new information. I used to brush my teeth
Yeah.
before.
So what I would say is brush every day twice, but morning after breakfast and night after dinner. So when you get up in the morning, most of them ask like, if you don't brush early morning, what would happen? Okay, what I would say is as soon as you get up, you just gargle your mouth with mouthwash. Okay, then have your breakfast, brush your teeth and go out for your work. When you go out for your work, the whole day your mouth is free of the food debris. Okay, and afternoon again you eat food. So after eating food you have some debris in your mouth, but yes, you cannot brush during the office time. So you can carry a mouthwash with you. In the afternoon time you can gargle with mouthwash. Then you come back home, have your dinner. Again you have food debris in your mouth. Before sleeping, brush and floss once and sleep well.
Okay, perfect. Doctor, can I ask you how often should we do the dental checkup?
Dental checkup is recommended once in 6 months. So make sure you go to a dentist once in 6 months. Now I will tell you why it is important to get it checked once in 6 months. See, there are so many diseases which are unseen. You may be good 6 months prior, and after 6 months you may have a decay. So if you go to a dentist That time he can assess your oral condition and he would tell you what is good for you. Like you may not have a decay 6 months prior, but after 6 months you may have a decay, but it may be in the stage 1, okay, without pain. So when you go to a dentist at that moment of time, we can fill the tooth without pain. So the best thing over here is you are getting the treatment done without pain.
Yes.
The phobia of dental phobia is very common among everyone. So the main thing what we fear is pain. So if you want painless dentistry, then have a regular checkup with the dentist and you will be free of dentistry.
Yes, this is true. So doctor, nowadays so many people, they do crowns, veneers. Can you tell us about this, and can you tell us about the difference between crowns and veneers and implements?
Veneers is the most common thing nowadays.
Yes.
You see any youngster, they want a veneer to be done. Now that comes with both advantages as well as disadvantages. Okay. Now why would a person go in for veneer? Usually a person who doesn't have a good smile would opt for a veneer.
Sure.
Okay, and if a person has a lot of decayed teeth in mouth, then he would go in for veneer. But it has a cons. Like pros, the cons would be if you don't maintain after veneer, that is even more worst. You will end up with bleeding gums, or you will end up with root canal treatment of almost all the teeth. Okay, so the most important thing over here to follow is first maintain the oral hygiene. Okay, go to the dentist, and if possible, take a second opinion from different dentists.
Oh.
Okay, normally a person will be like, I'll go to one dentist, get the work done from him.
Yes.
It shouldn't be like that, because every dentist will have a different opinion. Okay, try to take opinion from 2 dentists or 3 dentists, preferably from a specialist. Then he would tell you what is good for you and what is not good for you. Okay, so veneers are done usually when a person doesn't have a good smile.
Okay.
So he wants to enhance his smile. The best thing to enhance the smile will be braces, because it is more natural.
Yes.
Okay, you are naturally moving your tooth forward or backward. But veneer is an option when you cannot do braces.
Okay.
If a person is not a candidate for braces, then veneers is the next option. Like braces would take around 1.5 years for the treatment. Veneers would be done in 2 appointments.
Yes.
So if a person doesn't have time for 1.5 years, then he can opt for veneers.
Okay.
Okay, and yes, media personality or any person who is in media who wants to look really good, then he can opt for veneers.
Okay. Okay, doctor, what about the implements?
Implants.
Implants, sorry.
Okay, normally if a person loses the teeth, then there's an empty space over there. Now this empty space would lead to problems like not chewing properly. As a human being, I think the best thing what you enjoy in your life is eating food. Okay, and without eating properly, you would not have good health. So to eat well and to have a good life, you need to have good set of teeth. So if you have lost your teeth, okay, then the latest technology is we put a screw, okay, or a titanium screw into the jawbone, then wait for some time and replace it with a tooth crown, basically.
Okay.
So again, it cannot be done in everyone. There are again some people in whom we can do it, and some people we cannot do it. But yes, in most of the cases, 80% of the cases, we can do implants. Okay, so that is the latest modality of replacing the missing teeth.
Yes. Okay. Thank you so much, doctor. I would like to ask the audience if anyone have a question regarding the dental care. Anyone? Yes, please.
Doctor, I want to know about the gum sensitivity treatment.
Yes, sir. See, gum sensitivity, it is not actually the gums which are sensitive, it is the tooth which is sensitive. Normally, a tooth will have 3 layers. That is the enamel, the uppermost layer, which is supposed to be the strongest layer. The second layer would be dentine, which consists of the nerve fibers, and the innermost layer, which is called as pulp, which is nothing but nerve and blood vessels. Okay. So normally what happens is if a person is having a good amount of enamel on top of the tooth, then he would never have sensitivity. Sensitivity happens when the enamel is lost. When the enamel is lost, the second layer of the tooth is exposed. Now because it has lot of fibrils in it, a person will start feeling sensitivity. The only treatment for sensitivity would be filling it with a filler or using some medicaments to suppress the sensitivity.
Yes. Doctor, I have a question by my side regarding the whitening.
Yes.
Is it healthy for the teeth or not?
Yes, it is, but you should not make it a habit. Whitening are different types actually. Whitening is in office whitening that is done in the clinic, and whitening is at home, which can be done at home. So if you are doing whitening probably once in 6 months, then it's good. It's not a problem. But you cannot make it a habit.
Yes.
Okay, because basically you are bleaching the tooth. The material what we are using is to bleach the tooth, and if you are using it continuously, that would lead to sensitivity of the tooth.
Oh, yes. Okay, perfect. Thank you so much, doctor, for this information.
Thank you.
Just give me a second.
Yes.
Yes, please.
Hi, my name is Pratima.
Yes.
I know this question will be a little weird, but I'd like to know how do we know what kind of right toothpaste we should use? Because there are n number of toothpaste in the market. And yeah, because I would like to know about the specific toothpaste, that would be great.
When it comes to toothpaste, more than the toothpaste, it is how you brush, basically. So the brushing mechanism, how you brush is very important. Toothpaste, you can use any toothpaste. Yes, in some conditions, like if a person has sensitivity, then you will be using a sensitive toothpaste. But what I would say is use a sensitive toothpaste after using a normal toothpaste. Because normal toothpaste will have something called as dentrifies, which helps in cleaning your tooth surface. Whereas desensitizing paste will not have a dentrifies. So what I would recommend is first use a dentrifies or a regular toothpaste, brush your teeth, and then use a desensitizing paste. Likewise, there are some people who will have fluorosis. Fluorosis as they will have lot of fluoride in their teeth. Okay, so those type of patients should not use fluoridated toothpaste. They should use non-fluoridated toothpaste.
So is it advisable now, coming back to the brushing teeth, they have so many brushes electronically, the way it moves. So is it advisable to use the hand or?
No, electronic brushes have better advantages over mechanical brushes.
Okay.
Basically, because it can reach all those areas. Normally, a person gets tired, and most of the time, we are lazy to brush well. So, with electronic brushes, you can easily go to those areas, and you have to just place the brush well. So, the efficacy is better with the electronic brush.
So what should be the exact duration of brushing, like morning and evening? Because some people they just the brush and they roam around. So what is the specific time of brushing the teeth?
The brushing time recommended is 2 minutes. Okay, not more, not less. Recommended is 2 minutes, and some people keep brushing more.
Yeah.
By brushing more, it will lead to sensitivity because the enamel is getting lost over a period of time.
And one more thing I would like to ask is, why do we have this kind of a black teeth? Like sometimes initially I thought and it's not going.
Yeah, those are basically stains on your teeth. Normally, the food what we eat, we have plaque, and if you don't brush your teeth for more than 24 hours, okay, that would absorb the calcium which is present in your saliva, and it become hard. Once it becomes hard, below that there will be growth of bacteria. Okay, so this is basically the growth of bacteria plus food which has become hard. Over a period of time, it starts changing the color. It ranges from yellowish to brownish black. Okay, so you have to go in for a professional scaling if you find this type of stains on your teeth.
Thank you.
Thanks a lot. Thank you.
Thank you so much. Thank you, Dr.
Thank you.
Syed. I would like to call the Pharmadent representative to meet you.
Thank you.
Thank you so much.
Thank you.
Thank you. Thank you so much for your time. I would love to ask one guest to come to Let's Play. Let's have some fun. Who would love to come?
Must.
Yes, please.
This one I have to do that.
Please spend. Free pouch. Okay, congratulations. Thank you so much for your time and have a lovely day.